A patient survey, like the one that's presented today, is one of the ways of involving patients. By doing so, by making the survey, you can focus on areas of action in order to improve the healthcare system. Especially kidney patients can benefit from surveys because, as I already said, the treatment is very intensive, and it has a very strong impact on your daily life to be a kidney patient.
So some of the data is that over 1 in 5 patients did not receive information they found useful about kidney disease or dialysis option before going into treatment. 1 in 3 patients could not choose the treatment method or are unsure about how their choice are valued. And 1 in 4 patients start dialysis within 3 months after they've first been diagnosed with kidney disease. And this limits their choice for clinical reasons. Nearly 2/3 of the patients did not receive the education or rehabilitation they needed to help reconcile the kidney condition to integrate their day-to-day life.
But I think when you have treatment choices, like you have with renal disease, and indeed choices that make huge quality of life differences to which one you pick and which can you survive a job or not, that the patient must be centre to the decision-making process.
One of the conclusions we can see in the executive summary is that there is quite a lot of changes needed. There is a need for complete and understandable information about kidney disease that needs to be put in place. Patient needs to be informed in a clear and understandable, unbiased way about treatment options. And patient needs to be informed about their rights as well as responsibilities along the way about treatment options. And that healthcare professionals must accept that well-informed patients is a really good partner in decision-making process around the treatments. And if all countries could achieve the same standard quality of treatment, while at the same time making care affordable and accessible. And as a final point, it's very important to identify kidney disease early, rather than the stage 4, and this is to improve kidney care, because if you don't have a choice and a diagnosis early on, you will be forced into one or another treatment, and it also hinders later the transplant opportunities.
It's absolutely crucial that patients are well informed, because an informed and an involved patient has better clinical outcomes, has better quality of life, can manage their disease better, and it's the basic thing to know what's happening to me.
From the patient's perspective, I think their choices are twofold on education. One, are they educated? And two, are they educated about their diseases? So there's no question about it that that's a twofold thing. It is well known that the educated live longer, and because they can understand the choices they've been given, but it can take much longer for some patients to comprehend the differences they're being told or the choices they're being offered by doctors, and doctors tend to make decisions for those patients, and possibly because they haven't time otherwise. The availability of the treatments, that is not it's not evident that home hemodialysis was a good example that Peter used. It's only really coming back to the patient choice. It was used a number of years ago, and in excess of 30 years ago in Ireland, because we had island populations, and indeed peritoneal dialysis, because it took over for a good period, and indeed we are going back to home hemodialysis. So home therapies have two choices now, that in many countries, and people are realising that patients want the choice, and patients are getting the choices in some cases.
My main conclusion is that informing kidney patients and involving them in the decision-making process around their treatment is a fundamental right and should be a necessary cornerstone of any European and local health initiative. The results of the survey, however, show that we still have a long way to go to put this into practice across the European Union. So policymakers, healthcare professionals and patients themselves need to work together to make this happen. The right treatment at the right time for all patients is not only crucial for patients' quality of life, but it would be also far more cost effective. And I very much hope that this debate today can help in terms of triggering the appropriate action by the competent authorities in the European Union and in the Member States to address these challenges.
After this event today, I suppose when we'll really see if this event has made a difference is when we translate this from a European level into a national level. So it's all well and good at the epicenter when you're in Europe and you're making these presentations and so on, but it's really when it gets translated down to a national level and when the patients start to see a difference, that's when it'll really start to show.